Hello, everyone. Good Thursday evening. Thank you for listening to editorial or Kidney Editorial Edition with Kenneth Sorenson. Uh, Coming from beautiful Charleston, South Carolina. We definitely have a special guest on tonight. I'll mention him in just a moment. I also want to mention got some good news this week, or starting last week. And then last week I found out that dealing with diabetes was caused my kidney failure. My A1C is 5.4, which is absolutely incredible. The doctor was shocked. He said I don't have diabetes and mine's 5.3, so he was happy. Reduced my insulin. He said I wouldn't be surprised if we're going to be taking you off of it. He reduced my blood pressure medicine also, and he said if in the next few months I should be off of most of that too. Also, I went to my labs with my transplant center, and everything looks great. The doctor actually said there's nothing she would change right now. If she was me, whatever I'm doing seems to be working. So the kidney's working great. So God bless, and definitely God bless my donor. I talked to her a little bit today, and she's doing great too. She started a new job. She's happy. So eventually I plan on having her on so you guys can meet her. But let's talk a little bit about tonight. I had stage 5 kidney disease, obviously, and dealt with that. But the guy I'm having on tonight, I think he said he has stage 1 or 2, but he's more of a warrior than I've ever been, and I probably will ever be. He's incredible. He's on fire to spread the word, not only about kidney disease, but healthy eating, healthy lifestyle. And I'm very proud to know him and have gotten to know him over the last few months. And tonight, who we're going to have on is Steve Belcher. I believe he's coming from Houston tonight. He's kind of battling through his own injury tonight. And I asked him if he still wanted to come on. He's like, I'm not going to miss it. He's like, the fight still goes even if I'm not feeling good. So or feeling the best. So tonight I want to welcome him on the show. Most of the people watching tonight's going to know him already, but he's a great guy. And tonight we're going to talk a little bit about his history as a dialysis nurse, his recent struggles with some of health insurance and things like that. We're going to go back to the last previous 2 shows and talk about health insurance a little bit because I know he's very passionate about it. And we're also going to talk about dialysis, something that he probably even knows more about than me. And at the very least, we have different perspectives on it. So without further ado, I'd like to welcome Steve Belcher to the conversation, and
Hey,
we're
what's
going to
up,
talk.
Ken?
Good to see you, man. I see the eye patch. I know you're going through some stuff. I'm glad you were
Yeah,
still able to
yeah,
join
man.
us.
It's rough, man. But you know, physically, I'm doing okay. But mentally, it's definitely a challenge for me. But I try not to focus on the negative aspect of this because they say when you focus on what you don't want, you normally get it. So I try to keep myself focused on doing the shows and continue to raise kidney disease awareness in spite of what's going on with my right eye.
I know we all appreciate it. I was really worried about you when I heard about it, and was definitely praying for you. And I'm glad to see that you're staying positive. One thing I know about you in the short time I've known you is it's very rare that you're not positive. Other than when we're talking about the atrocities going on in this country with kidney disease and healthcare and health insurance and dialysis. So you're a positive guy, and there's some days that I don't want to be positive, and I just read some of your posts on Facebook, and I'm like, you know what? If Steve can do it, I can do it. So
Yeah, I appreciate that, Kim. But let me just say that every day is not positive. I definitely go through my struggles. I try to remain positive, but at the same time, I'm human, and no matter what, I mean, when we're human, we're going to experience something. I don't care, you know, the person that has a lot of faith, but at some point, we all worry about something. And like I said, I try to remain positive 90% of the time. But, when I'm out of, the spotlight or, by myself or, personal friends, sometimes, I could be real negative and I have to talk to, people who can get me back on track and to show me that, God is in control.
yeah, it's so important to have those people because because you know, as you said, the most positive people in the world aren't always positive. I read something, and I'm going to paraphrase because I don't remember exactly, but I saw something about like how being positive doesn't mean being happy all the time. You know, it sometimes it means you are struggling, but it does mean you try to look at the bright side of things if at all possible.
Oh,
You know,
absolutely,
so
absolutely, man.
yet again, I'm glad you're here with me. Let's talk a little bit about let's talk. I want to get to know you a little bit better because I know some things about you, but I don't know a lot, and I want to learn a little bit about you. But I also want to talk to you specifically about dialysis and health insurance because those are things that you and I've talked to about off the air, and that you and I are both very passionate about. So why don't you tell us a little bit, like, where are you from, Maryland originally? Where are you from originally?
So Ken, I was born and raised in Washington, D.C. Um, right after high school, I went in straight into the military, um, and I did 3 years in the Army. And after the military, I landed in Killeen, Texas, where I ended my career in the military. And me and my wife at the time moved to Austin, Texas, where I started um, going to a medical technologist school, like a trade school, and for medical assistants. And that's how I found out about kidney dialysis. I went to the job placement person about 3 months in, and asked if they knew where I could find or apply for a job to get on the job training. And from there, when I started dialysis, I moved back to DC after 3 months on the job, and I just couldn't make it down there in 1985 with the cost of living. And at that time, I was only making $4.18 as a dialysis technician.
Gosh. I mean, I know that was a while ago, but still, I mean, you're sticking people with needles and you're getting paid $4.18. But anyway,
Yeah, yeah. And so I moved back to the DC area and continued my dialysis career. And then in 1991, I had a patient kind of convince me to go back to school for nursing. And that's what I did. And it was the best thing that I could have, the best advice that I could have done at that time.
where did you go to nursing school?
Well, I went for my associates at University District of Columbia in DC, which is UDC. And then I got my bachelor's from the University of Maryland in Baltimore, and then my master's from Walden University.
Awesome, awesome. That's so good to hear. So tell me about the kind of the start of the nursing part of your. Well, actually, you know what? I'm curious. What was it like being a tech back in 1985? Like, had the rules changed? Like, what was different between being a tech then than maybe people experience now?
Sure. Well, back then in the 80s, being a tech versus being one now, technicians were able to work in hospitals alone. Okay, so one of the jobs that I had, I worked with a company called Renal Management that did acute dialysis in hospitals. And so as a technician, I was giving blood when I worked for this company. I was a kind of like not a manager, but I was responsible for a hospital. So meaning when I was on call, or if I had a patient at this hospital, I'll go and I could go in the ICU and write orders in the chart. I could give blood, and now technicians can't do that. A nurse has to administer blood. Technicians, if they're doing acute, uh, like on the ICU floor, at least at the hospital where I last worked at, they could run the patient, but a nurse has to be in the vicinity. Okay.
Hmm.
And and then a lot of places now, especially down south, back then, and even up north now, technicians are able to do catheter care and administer heparin. In some states, technicians can't do that. It's left up to the nurse,
Yeah.
and Georgia is one of them.
Yeah,
So
South Carolina techs can't do that. They can stick fistulas and grafts, but catheters have to be done by RNs.
yes, and the thing about that, that wears down the nurse because um, if let's just say if you have a clinic that has maybe 7 or 8 patients that are catheters, and this is a 25 to 30 chair unit, and maybe you only have 1 or 2 nurses. I mean, that nurse, it's like you got to come up with some type of system so you can, move efficiently and effectively to start that treatment. And
Yeah.
sometimes it's, with the rushing and everything and the demands that the company put on you, sometimes the jobs are kind of half done. When I mean half done, like you may not follow the whole process of the steps during catheter care. Like you may initiate the treatment and then come back at a later time to clean the catheter instead of cleaning it right then because you got 4 or 5 other patients that need to go on.
Yeah.
So you try to do all you can to initiate the treatment safely and effectively. But you know, again, with the Russian and that being a part of the job, some steps are liable to get missed. I mean,
Yeah.
even from down to washing your hands. You may use the hand sanitizer most of the time and not just go there and wash your hands for 15 to 20 seconds like you're supposed to do with soap and water.
Yeah, I noticed some. Yet again, I went to a pretty good clinic, but even down here, I don't know what it's like in other states, but before every patient leaves, a RN has to assess them.
Sure.
And so not only are they responsible for every catheter in the room, they're also responsible for anyone that needs to leave. And you know how it is when patients are done, they're ready to go, Steve.
Oh,
And so you have
absolutely.
you have all these people staring at you. I mean, there were times when I had a catheter for a year and a half, and there are times where I probably had to wait an extra half hour just because they were just too busy. I mean, and they kept me updated and things like that. And for the most part, the nurses at my clinic were really good. But man, I mean, that's a lot of pressure because basically everything that goes on at those clinics are up to the RNs.
Pretty much. Pretty much.
At least down here. I don't know what it's like in other places, but I know down here, like I know the clinics that I go to. If you have a weak RN on, you might as well decide you're going to be there an extra 2 hours because it's not. I mean, it's incredible. Like I
No,
would
I
just
know
go.
exactly what you mean.
I would just go in and say there was one nurse in particular named Christine. I'd be like, "Hey, I'll wait extra out here in the lobby as long as you can get me on with Christine. Like, I'll wait, that kind of thing. I don't
Yeah,
mind because
and
I'll
that's
waste a
that's what
half hour
happened.
there. I'd rather waste a half hour there than 2 hours sitting in the chair extra. So
Sure.
okay, so that gives us kind of an idea what it was like. Then tell us a little bit about like what it was like being an RN. I know you did various different kinds, like you worked at hospitals, you worked at clinics, that kind of thing. Talk to me a little bit about the difference as an RN working at a hospital versus, because I can tell you what it's like as a patient, but you can tell me what it's like as a nurse.
Sure. Well, it's a big difference, Ken. And what I mean by that, depending on what part of the hospital you're working at, because some hospitals have units. Like
Yep.
in the last hospital I worked at, it had 27 to 28 chairs. However, they also covered upstairs in the acutes. So I mostly did acutes when I worked in the hospital. I mean, I did it all, but the one difference with working in the hospital unit and working in an outpatient clinic is that if you're one of the nurses that rotates in the acute unit, you may be on call, like weekend call. If a patient comes in, after hours, you got to come in and dialyze them, opposed to if it was an outpatient unit, you
They
work,
close at a
Monday
certain
with,
time. Yeah. Yeah.
yeah, the shift time.
Yeah.
And another thing with the hospital units, you pretty much have access to emergency care if you really needed it, opposed to the outpatient unit. If something goes wrong, you got to call 911 for them to come. And even with some of the hospital units, like the last one I worked at, Union Memorial, even though it was connected to a hospital on the other side of the building, the emergency room, and it was separate, it's standalone, that we still had to call 911 if a patient had an emergency, and the ambulance would come and drive around on the other side of the building and drop them off, opposed to, because the thing is, where the dialysis unit is in a hospital, some hospitals, the if you call a code or whatever, the hospital personnel come down and come to the unit.
Yeah. Mm-hmm.
But if it's a separate entity, then that's not going to happen.
Yeah, I mean, you might as well have the clinic somewhere else. It just so happens the response time's probably faster, but you might as well have the unit somewhere else. Yeah.
Sure.
My experience is and yet again, I think maybe I was lucky, but the two dialysis in hospital ones I went to were actually in the buildings, and they were like a section of the hospital, that kind of thing. And the two ones I went to, there's Trident Hospital here in North Charleston, South Carolina, and then there's MUSC where I got my transplant downtown. And I'll tell you this, both those units were way better than any regular clinic I went to. It wasn't even close. I mean, MUSC in particular, I mean, they aren't looking to make profit. And so, like, I never had a tech put me on the machine, even when I had a fistula. It was all RNs that dealt with me, and each RN had like 3 patients, as opposed to how it is in a clinic where each RN has 15 people, that kind of thing. It was pretty remarkable. And then the one at Trident only had like 4 beds, and there might have been 2, maybe 3 staff members on at the time. I mean, it was the doctor, a nephrologist hung out inside the dialysis unit most of the day, that kind of thing. So if you ever had any questions, you had like extremely good access.
Yeah, that's
Trident,
good.
Trident
Because
Hospital in general isn't very good, but that particular section of it was.
yeah, I mean, if you got a nephrologist hanging out in a unit pretty much the whole day, that's great, because up north here, a lot of nephrologists, because they got so many patients,
Mm-hmm.
and there's so many units, that they're going to other places, like traveling the whole day seeing patients. So um, they may come in, and if you sleep, they may just tap you on your foot.
Yeah.
And if you don't wake up, they could just probably write something, look at your blood pressure and look at
Yeah.
your vitals, and say that sleeping, stable, vital signs are good, and keep it moving.
Yep.
And the thing is, you don't get, if you have some concerns, you don't even get to share them with the doctor because he's gone.
No, you're exactly right. I mean, I was, that happened to me before, because I remember when I was at a unit, and they don't like waking you up because, first of all, sometimes that's all the sleep you're getting, because if you're actually in the hospital, they're waking you up constantly for, medicine or different things like that. So you're exactly right. I mean, I remember when I was at my sickest, that was definitely something I encountered. And at MUSC, they make it really easy for you to sleep. You kind of have your own like cubicle. You're in a hospital bed. It's very comfortable. You can turn out the
Sure.
lights in your room. They want you to sleep. That kind of thing. So I definitely understand that. So the next thing I want to ask you is, okay, so I'm sure you encountered a lot of difficult things during your career. I think I've even talked to you about some, but like, let's say Steve was running dialysis units. Like, let's say you were building your perfect dialysis unit. What would that look like to you?
The
Money's no object. Money's no object. Whatever's needed.
So, I mean, the perfect unit for me would be like a 18 chair station, something kind of small. Um, Everything that it needs, far as the proper staff, people who genuinely care for their patients. And for me, um, when it comes to bringing people on board for dialysis, to me, you want to make sure that you have people that display compassion, empathy, um, and all the other characteristics to treat someone dealing with a chronic disease. And we know that every day is not going to be a good day. So, patients have lives outside of dialysis. You never know what they may be going through. So if somebody comes in and they're not their normal self, or maybe little with some high anxiety or being angry, um, you got to empathize with that person because you don't know what they're going through outside of here. And a lot of times I witness technicians or even nurses when a patient may be a little verbal or upset, that they may kind of engage back in a negative way and kind of make the situation worse. But getting back to what you were saying with the perfect unit, it would be a unit that pretty much catered to people, for their work hours, far as great staff that don't mind doing what they're doing. Okay.
I have a quick question. So, let's talk about staffing just for a second. All right, so an 18 chair unit. What do you think is the right amount of staff to have on a shift? Like, how many nurses should be there during it? Like, yet again, if you know what it's like to be in the thick of things and all that stuff, like how many techs should be on an 18 unit,
Well,
you know?
reason I said 18 because here in Maryland it's 3-to-1 ratio, so that means there will be six techs, okay, and each one will have three patients and two nurses and a charge nurse. So the one charge nurse would be separate, would just run charge, answer the phones, and do what the charge nurse does, and
Hmm.
then two staff nurses. So one nurse would do the assessment of 9 patients, and the other nurse would do assessments of the other 9 patients, thus leaving the charge nurse free. But what happens is they don't run it that way.
Hmm.
If that was the case here, like an 18 chair unit, they would have two nurses. One would be charge, and the other one would be the staff. And the charge nurse will be assessing 9 patients, and the other nurse will assess 9 patients. And what normally happens as the census gets lower as the day goes on, meaning that the staff, and I'm sorry, that the patients census drop at a certain point, they let the other nurse, or they want the other nurse to leave. And so you got one nurse, maybe you may have 9 patients, let's say, and one nurse and um, three techs. But they, again, that one nurse is the charge nurse, and they gotta, and they may have to take a patient assignment and send one of the techs home. And so that happens a lot as well. They'll get a charge nurse at the end of the day. If it's 9 patients, especially here in Maryland, they'll tell you to send one of the technicians home, and that the charge nurse takes 3 patients, and then the other two techs take three. And you know, one thing that concerns me with that setup is, if something goes wrong with one of my 3 patients, then I'm the one that, someone has to call 911. I'm the one that has to initiate, protocol
Hmm.
like CPR, and run the code. And then it's just me by myself, as far as licensed personnel. So I could be there, and it could be the other two tests could be brand new, maybe 6 months or less experience, 7 or 8 months, and it's just me. And you got a code, and maybe they never been through a code before. And now it's just me and two other people, and I got to direct these two technicians on what to do, plus take care of the patients. Plus, at the end of the day, I got to write my notes and everything that happened. So I'm going to end up staying there longer, which is okay. But that's a lot of work for one nurse when you've been there for 10 or 11 hours, 12 hours out of the day, and you got to finish up maybe work from earlier. You may have to put in orders that the doctor may have left. He could, especially if it's right after lab drawer, and patients get their lab back, then the physician may come in earlier that day and look at the lab results, and
Mm-hmm.
they may want to give patients start iron series, or change the EPO dose, or change the Zemplar, and so when that happens, the nurse has to change those orders in the system, and draw it up at the same time. So that still got to get done. So a lot of people don't see this, as far as the warriors that do dialysis and don't understand. A lot of the nurses are tired at the end of the day, especially if it's only one or two, and you doing you know multiple assessments, especially up to uh, 15 patients. I worked at a unit where it was just two of us, and it was a 30-chair unit, and I
Yeah.
was responsible for 15 patients.
Yeah,
And
that sounds similar to my clinic. I mean, there might have been, I don't know, a little less than 30, but there was usually only two RNs on, and maybe three or four techs. I mean, it depends. I think the techs had like five or six patients apiece, that kind of thing.
yeah,
You
in
know,
different states, the ratio could be 4-1, 5-1.
I mean,
Uh,
it's ridiculous. Like, how
yeah,
can you provide good care? Well, and the problem that those regulations allow is it allows these companies that are trying to make profit off of it to stretch it as far as they can. Like, they're not going to say there's a 5-to-1 law and then put it at 3-to-1 for their company. No, they're going to do the 5-to-1.
sure.
So they're going to try to make as much profit off of this business as they can, and I mean that's kind of disheartening. And when I talked to my episode about dialysis, I mean, dialysis really hasn't changed much since 1962. I mean, like these companies have no incentive to make it better for us. And it's very disheartening. I mean, and I'm sure you saw it all the time. Patients were miserable there. And don't get me wrong, even in the best of situations, Steve, dialysis isn't going to be fun, but
Sure.
it can be better than it is. And it certainly isn't. And I'm not even just talking, better for those of us that are getting dialysis, but it also needs to be better for those of you administering dialysis, because what's the rule, like in companies in general? Happy employees provide better service. you
Yeah,
know
and they pretty much try to do that with different incentives to employees. However, it's gotten to the point now with DaVita, they done cut those incentives out. If they need help at one unit, they would send out like a fax and say, we'll give you X amount of dollars per hour if you come and help us out on this day or that day. But when you come down to it and you do the math and the taxes, it really, I mean, it's not like you could do like 80 or like a 90 or 100 hours. And you got some techs that work like that. And those, man, they get eat up in taxes because of the money that they make. So I say that to say, even with these incentives, even they want to give you an extra 50, 200, or whatever, it's going to be eaten up by,
yeah.
by taxes. And, you really don't see a lot of that money, but you're tired as hell at the end of the day.
I can only imagine. I can only imagine. And I don't know how much more time we're going to go, but we'll I
We
do
can
want.
go up to about 10 minutes to 9.
Okay, sounds good. let's talk a little bit about insurance, and I hope you don't mind sharing kind of your current insurance situation.
Sure.
And then we'll expand upon that. What's going on with you in insurance?
Um, so as everybody knows, well, maybe not everybody knows, but I used to work for the Vita as of January of this year. Ended. I was fired because I had a workplace accident where I slipped on some solution in the employee's locker room that leaked from a dialysis station into the employee's locker room. But that injury rendered me not able to work as a dialysis charge nurse ever again. And because of that, I had to file workman's compensation. Now I'm looking for a job, but it's specific job, telephonic nurse, case manager. In in these type of positions, you really need experience. And the education I have, that doesn't mean anything to a lot of these companies. They want you to have the experience. So as a result of not working, of course, I don't have any insurance. Okay. The only insurance I do have is connected with the workman's comp case. So anything that goes on with my back, my lower back, yes, I can get treated for. But as you see, it's my eye now,
Mm-hmm.
and I don't have any health insurance. I'm not on the Affordable Care Act, which I plan on getting some insurance very soon. But the one thing I found out during this process, Ken,
Mm-hmm.
is I'm a veteran, and I went to VA thinking that I was going to get free health, insurance because of my situation. I was denied VA coverage because they said I made too much last year, and they have a threshold, almost like Medicaid, where
Mm-hmm.
if you single and you get this amount, if you have someone or someone else in the household, you get this amount, and even the threshold for a single person was 30,000, and I make more than that with the workman's comp, payments, but it's like it's almost like it's like I don't make enough and I don't make too
Yeah.
little. I'm like in that middle part
Mm-hmm.
where it's like I can't afford the regular insurance, but then I don't qualify for Medicaid or medical assistance.
Yep.
And I found out in the hospital, when I went to the emergency room, they was trying to get me medical assistance, and when I told them my situation, it was like, nope, you don't even qualify for medical assistant. They what was told to me, and this just was a person who mentioned it off record, is that type of insurance like Medicaid, and they could be wrong, but it's not designed for single men or single black men. Let me just say that, but for women who may be getting, you know, that's on welfare or with a child. It's designed for that.
Well,
And
I can attest to that. I went to the Medicaid office to try to get Medicaid when I first got disability, and I think I've told this. I made $33 too much, and the first thing they asked me was, "Do you have any kids?" And I'm like, "No." And they're like, "I'm like, so I would qualify if I had kids." And she said, "Yes." I'm like, "So because I was responsible and didn't have kids when I shouldn't have had them, I wasn't in any place to have kids, but because of that, I'm being penalized." And she said, I guess so. And I'm like, that's very disheartening. Like
oh,
I
absolutely.
I was making $1,033 a month, and I couldn't qualify for Medicaid. I mean, that's not a livable wage.
It's not.
I had to make 1,000 or less or something like that. And I mean, it's frustrating living in South Carolina. I don't know what it's like in Maryland, but also like as I said in my last episode, South Carolina refused to get the extra help that Affordable Care Act added to Medicaid. if they would have done that, the threshold would have been higher and I would have been able to get it. But because South Carolina decided to deny the help from the federal government, I didn't qualify.
Mm.
So I mean, I understand, like, it's not designed for people, and I understand that, but I was making $1,000 a month, Steve. I mean, like, and I couldn't qualify for help with health insurance. I mean, it's
That's
crazy.
ridiculous.
I mean, it's crazy. But anyway,
Yeah, you don't, you really don't understand the depth of this until you experience it yourself.
you're exactly right. If you'd have talked to me, I don't know, 5, 6 years ago, I'd been like, "You're crazy," and then now that I've tried to navigate it, I'm like, "Oh my gosh, this system is as messed up as people say."
Sure, sure. And
Mm.
that's why, for too long, Ken, working as a nurse, working 33 years in dialysis, always had health insurance through the companies. And now when I'm at my lowest point, not working and no health insurance, it's definitely disheartening. But I'm going to keep pressing forward. And if I don't, I want to go still get the treatment as long as I get treated. I mean, the good thing about this is, by me being a nurse, I can, when I go to the doctors or get treated for what's going on in my eye, I can ask the hard questions,
Yeah.
know what's going on, opposed to someone who may not be a nurse or understand anatomy and physiology, and the structure of your eye, and all the tough questions you need to ask to make sure you have well, not to make sure, but to see if the prognosis of your condition is going to be favorable. Um, if you don't know that, then you're pretty much subjected to anything, and not getting the best care possible,
Well,
and almost not like, like being your own healthcare advocate.
yeah. Yeah. What I was thinking is you can also make your doctor's visits more productive, because you're not going to have to go back 3 times. You're going to ask the question the first time, and make your decision based off of an education that you have, as opposed to, well, I hope this works. Okay, this didn't work. Let's try this. Like, uh,
Sure.
they were talking in the NBA. One of the big stars in the NBA got hurt, and they were talking to a guy that was a big basketball player from Duke, and he said that when he got injured, the doctors were literally practicing medicine. And he's like, and if I could go back and do it all again, I would have studied it more myself and been able to make, educated decisions rather than them
Sure.
say, let's try this, that kind of thing.
Oh, absolutely, man. Absolutely. It's
Um,
almost like they could be almost experimenting on you.
You're exactly right, and I know medicine is a science, but there's also a little bit of an art to it too. I understand that, like when I had my stomach at the worst it was, my doctors tried everything they could think of, and at a certain point they were kind of just throwing darts at a wall, saying, "Hey, this has worked with this person before. Let's try this with you," that kind of thing. They had no, they had tried all the stuff that they knew would definitely work, and it didn't work, that kind of thing. So
Mhm.
and one thing I say about, like, even, health insurance too is we can help pay for people to get health insurance now, or we can do it by what they do, and that's going to the emergency room. Either way, taxpayers are paying for it. It's just how do you want to pay for it? Do you want to call it universal health care, or do you want to call it, hey, we're going to pay we're going to pay hospitals to take these people that don't have insurance. I mean, you're one of the people that'll, I'm sure will, make payments towards your bill and stuff like that. But most of the people that go to the emergency room without insurance aren't paying a dime towards that.
Right.
They're writing it off. I was talking to someone, my physical therapist today, a little bit about it, because she's pretty passionate about it, and she was telling me that, one of the reasons hospital stays are so high is because the hospitals are writing off so much money in order to make themselves at least kind of viable,
Sure.
that kind of thing. So they have to charge, $10,000 for a hospital visit, knowing that they're going to write off 8,000 of it, because either insurance companies or people in general aren't going to pay that 10,000.
Hmm.
It's definitely, it's definitely interesting, and the Affordable Care Act was definitely meant to do good, but what's ended up happening is it's been kind of bastardized, and people have taken certain parts of it and things like that, and there's definitely some things that needed to be corrected in it. But no law is perfect when you first pass it.
Absolutely.
But the thought behind it was pure and good. Like the whole thing was to kind of control insurance companies, to kind of say, hey, this is what you have to do, that kind of thing, as opposed to now, like the CEA of United Healthcare makes $67 million a year, Steve. 67 million.
I
I
know.
mean, that's crazy to think about. You got people that are dying because they can't go to hospitals, and you're making and I do have it hard pressed for me to count someone else's money. You know what I'm saying, Steve? I
Sure.
can't fault what people make. He's paying what they're willing to pay, or he's getting paid what they're willing to pay him. He's not going in there saying this is my salary. They're telling him what they're going to pay him. That kind of thing. But on the other side of the coin, I mean, there's got to be some sort of standards with it. I mean, you who's fighting your tail off to save people's lives doesn't have insurance. You know what I'm saying? Like, why is that the case? And a lot of my friends, that I grew up in a very Republican area, or very conservative area, and a lot of people are saying, well, helping people, they should help themselves and things like that. Like, I can attest to this, Steve. I was one of those people 10 years ago. And
Right.
now and
Right.
now God's put me in a different perspective, and I'm like, you know what? Some people can't help themselves. Like, they can't. When I was sick, Steve, I couldn't work. It wasn't like I was choosing not to work. I couldn't work.
Right.
You
Right.
know that kind of thing. And there's a lot of people in that position. And there's a lot of people that just they can't do it. Or like I've been doing some studying. Like even socioeconomic people. People are definitely set at a disadvantage. That kind of thing. You can't expect someone that grew up poor to become rich. There are
Oh,
people that have
absolutely.
there's people
Absolutely.
that that's happened to. I understand that, but there's way more people that it hasn't happened to. That kind of
Wow.
thing. It hasn't been modeled to them, Steve. They don't know. They don't know what it's like to get an education because their parents didn't get an education. That kind of thing. And so we have to kind of keep in mind that not everyone's the same. You can't judge people by your upbringing. You have to judge them by their upbringing.
Absolutely.
You know.
Absolutely, man.
So,
And I think that's what happens a lot.
yeah, they try to put people into one category, and you can't do that. You just can't. And I think it's ridiculous that people try to. There's many warriors that are part of your network, that are part of different Facebook pages, that would love to be working 40 hours a week, and would love to be out of bed, and would love to be doing all kinds of stuff, but they can't. They're sick. That happens, and we can't. One, like, it's very biblical to take care of people that need it. That's something that like definitely Jesus wanted. That's what Jesus would have done. If we're talking about that, they wouldn't be putting people, they wouldn't let he wouldn't be ignoring people because they needed help. Those are the people he'd be after. So
You're right,
so
man. You're right.
and I know we're we have to wrap up because there's another show coming on and stuff. But
No, we can actually go on till 9.
all right, awesome, that sounds good. So like I talked about last time also with the Affordable Care Act, is when I was out of work and was making no money, I tried to call because I'm like, hey, I need money, I need insurance, and a family member was willing to put some towards it, that kind of thing. So I was like, that way I could have some insurance, that kind of thing. And I called up, and they were like, and I was like, well, I make no money, so clearly, Steve, they're going to give me a really good price because there's subsidies for people that make no money and stuff like that. So I called, and they said it was going to be like $400 or $500 a month. And I said to them, I was like, but I don't understand. Isn't there subsidies? And they said, you get tax breaks. And I'm like, well, I don't file taxes because I make no money. How can I get a benefit? And she's like, I don't know what to tell you. And so that's another loophole in the thing, is you have to make something in order to get the subsidies. And so, I mean, it's a sad condition because, here I am sick, and I'm trying to figure out what I'm going to do. I was scared to death, man. I was dying, I was scared to death, and I'm trying to maneuver this very confusing maze in order to do what's best for me and my family,
Hmm.
that kind of thing. And what's so funny is I called the National Kidney Foundation because I'm like, man, they've got to be one of the foremost experts on things like this, you would think. I called and said, "Hey, can you give me any advice on insurance stuff? Like, do you have anyone that deals with that?" They're like, "Oh, I'm sorry, we can't." I'm like, you have no one on your staff that knows anything about maneuvering, the insurance system for kidney patients. And they said, no, unfortunately, we don't. And I feel bad because I mean, my other excuse is I was sick at the time, but at the time I was, participating in trying to put on a walk here in Charleston and stuff like that. And then when I saw them, and that's the first time I had ever reached out to them, and they didn't even give me a name of someone outside of their organization that I could talk to. They just said, "Yeah, I'm sorry, there's no one that can help you." It kind of
Hmm.
soured me on the organization, and I ended up not, I was sick too, so that's part of the reason. But I ended up not helping out. I mean, I feel bad now, but at the time I was frustrated. I was a little bit angry, Steve, because
No, I can
you know,
imagine.
here
I
I
can
am,
imagine.
me at my weakest, and I'd never asked for anything in my life, like between my family when I was growing up and what during my adult years, I didn't. It's not like I tried to go on food stamps. It's not like I tried to get Medicaid or anything in the past. Like I paid insurance and I had horrible insurance, but I paid for it and I, did what I supposedly was. I was supposed to be a, good taxpayer and do all that stuff. I did everything I was supposed to. And then when I finally needed help, there wasn't any for me. And I know
Yeah,
you're feeling me too,
I feel the same way.
it's like you look behind and everyone's like, well, and I think the other thing I found out too, which I thought was interesting is there was people I knew that were making more money than me that were able to get help from the government or whoever else.
Mm,
And I was really frustrated because the thing was, Steve, I didn't know how to work the system.
mm,
And there's people out there that live off of working the system.
hmm.
And what that ends up happening is it makes people like you and me look bad when we're trying to get help.
Exactly.
That kind of thing. And so it kind of made me, and yet again, those people that are making more money than me, they may have needed help. You know what I'm saying? I'm not saying they didn't.
No, no, absolutely.
It's not my place to judge whether they need it or not. It's my place to
Hmm.
say, hey, if they need it, I do too.
Right,
Or
right.
why can't we both need it? That kind of thing. So like, what have you tried to contact like the I know what open enrollment starts in like November, doesn't it, for Affordable Care Act?
I believe so. What I've gotten from the last hospital I went to was some paperwork to fill out for hardship financial assistance, and I'm not ashamed to
Yeah.
mention that, to say that, and that's what I'm going to do. And you're right, I am going to pay something toward those hospital bills, but I'm not going to kill myself to
Yeah. Hmm.
and go broke trying to pay those bills. I'm going to honestly and sincerely pay amount that I can manage.
Comfortably. Yeah.
Yeah, and just go from there. And I'm just leave it in God's hands. There's nothing more I can do if I'm sincerely, making an honest payment. That's all I could do. But one thing I did want to say that has nothing to do with the my insurance. I know we getting down on time. That I hope you would possibly um, continue next week. Not but the one thing that I find appalling that patients find themselves in at one time and they didn't know um, was DaVita, and they got called out on this, is that when the Affordable Care Act originally came out, what DaVita started doing is creating what's called financial counselors. And what they were doing, and I seen this, but I didn't know at the time that this was happening, what was behind the scenes of this. But what was happening is they were linking up with Kidney Fund, and they already give Kidney Fund, like one of their sponsors. But what they would do is the financial counselors would go to patients, mostly minorities, that were on Medicare or Medicaid, and get them to sign up for the Affordable Care Act or Obamacare, steer them to one of those companies that's are participating, like Aetna or United Care.
Yeah.
And what would happen, they would get them to sign up for that, and the kidney fund, which is a nonprofit, DaVita would donate money to the kidney fund. That money would be used to pay patients premiums for the insurance, okay? And then that way, that gives DaVita the go ahead to charge the insurance company
Yeah.
3 to 4 times more than what they would get paid from Medicaid or Medicare. So Medicare reimburses like 260 or somewhere around there per treatment. Now, what would you rather do? Get paid $260 something per treatment, or $4,000 to $5,000 per
Oh no,
treatment?
you're right. It's a racket. You're exactly right, because that's exactly what's doing is DaVita's acting like they're altruistic when in actuality they're just making more money. And the kidney fund is complicit in it. And they can lie and say they don't know that's going on, but they're lying because it's clear. I mean, they've got to be smarter than that. They have to be. They have to think there's this for profit business. Why are they wanting to help us out so much? you know
Oh, absolutely.
there's got to be a reason. Businesses in general aren't, I'm not saying all, so don't people get mad, but
No, right, right.
businesses in general aren't that altruistic. They're as altruistic as they need to be, that kind of thing, and usually not a penny more than that. So man, I mean, I didn't even think about that. That's pretty crazy.
Mm-hmm.
I'm,
Mm-hmm.
I,
And
I'm
so when patients see those bills for 4 or 5 thousand, you know, not even sure what the copay would be on these as well.
Yeah.
Okay. Now, when you get paid, the Medicare paying 261, 80% of that ain't much,
Yeah.
you know, and it's it, with these for-profit companies, that's what it is. Like you said, for profit. So they want to do everything they can to make that bottom line. And I witnessed all that, from getting rid of certain supplies that
Hmm.
they used to use for patients, like larger alcohol pads, and they down to like a small pad, or the size of the four by four gauze, or the quality of these supplies. To not They used to had pillows and sheets on the chairs. They done away with that, and so that's why they done away with that, because it's more cheaper to give somebody a thin, cheap blanket with your brand name on it. You could buy 1,000 of them
Yeah.
at a small price,
And it almost
opposed
costs
to,
you nothing when you buy
yeah,
in bulk that size. I mean, it costs you little to nothing per patient. You're right.
yeah, yeah, opposed to um, reordering paper sheets and little small pillows and the covers that go over them, every time. That's money, opposed to those blankets and the
Yeah.
bags and the headphones and little stuff like that. And I, you know,
It's
I
sad.
just kind of get disgusted when I start thinking about it, because I these companies in the beginning, I know they meant well, and they still do in some places. But when you have a company that's my camera went out, we're hit with multiple lawsuits, something got to be wrong.
Yep, I agree. Well, I know we got to go because it's 9 o'clock, but I just want to
Sure.
say thank you, and I definitely going to have you on again real soon because I enjoyed talking with you, and I know you know a lot about this stuff, and I don't know if there's many people out there that's more passionate about it than you. So I appreciate it, and I'll talk to you again soon, and good luck on the next show, and I'm praying for your eye, man.
All right, thanks, Ken. Good talking
All
with
right,
you. Thanks for
yes,
having
sir.
me on.
My pleasure, Steve. Have a good night.
All right.
All right, bye bye.